Ongoing blackouts are dealing quite a major blow to the country's health sector in the Eastern Cape. We understand services there are also decreasing as the country experiences higher stages of power cuts. Health Minister Dr. Joe Phaahla is in Danzane assessing the situation. And our reporter Ronald Masinda is there and joins us now for more on this. Ronald, a very warm good morning to you. I mean, quite a significant visit here by the Health Minister Dr. Joe Phaahla assessing, of course, service delivery, particularly in the health sector. What are some of the problems in the Eastern Cape province when it comes to health service delivery?
Good morning, Tumelo. Well, it is a very important visit for Dr. Joe Phaahla to assess some of the challenges faced in the province. Some opposition parties will tell you that the province is faced with a myriad of challenges, and one of those is the medical claims which have been affecting the budget of the provincial health department. But the department says it has a lot of these challenges under control. Having spoken to some members of the department, they say that even some of the debt that they owe is manageable. But today is, I guess, Doctor, a fact-finding mission.
Well, thank you very much for having us. Indeed, we are here, myself as a minister with a team from the National Department to visit our colleague, the MEC and her team. This is part of our normal, visit to provinces, as the provinces are the front line of delivery of health services. So we're spending the whole day here. We actually would have liked to spend 2 days in some provinces. We've done 2 or 1.5 days, but due to pressure of Parliament and other activities, we're only here for the full day today. The purpose is really to be appraised by the province in terms of the programs which they are running and the challenges which I heard when you were talking to your colleague mentioning some of the challenges. Let me upfront say that the Eastern Cape is a very important province for us in the health delivery services, but also overall in terms of improvement of services in the country, because it's one of the most rural with a very high population of rural population, and also one of the poor provinces in terms of work opportunities and economic opportunities overall. So we are here to get deeper into understanding some of the challenges while also appreciating some of the good work that is here. We know that because of the fact that it carries a huge burden of services for ordinary poor people, it is facing a number of challenges in terms of human resources, as allocations of funds has been reducing, especially it's one of those provinces highly affected after the COVID pandemic, where we had been given additional resources to hire more staff to support our facilities. And when those grants were reduced or even terminated, it's one of the provinces which is bearing the impact of that. So there are quite a number of issues, but our purpose is really to support them to get the detailed understanding, so that as we work with them to improve and make sure that we can improve the quality of services. You know that a few months ago, on I think it was the 13th of June, we passed the National Health Insurance Bill in the National Assembly, and we are laying the foundation for implementation of a universal health coverage. And a province like the Eastern Cape is very key, because this is mainly, that NHI is mainly to improve quality of service, especially for people who are not covered by a private health insurance, and this province is one of those.
Doc, before I let you go, I know you're not going to say a lot because you are still going to go around some of the health facilities, or this health facility in particular. One thing I want to ask you, the issue of load shedding. I mean, we're experiencing arguably the worst stages, with some media houses even anticipating a possibility of stage 7. How is this affecting health facilities in general?
Well, we hope that it doesn't go that level. I mean, from time to time, I mean, we do get briefings. As you know, the Minister Hossein Soramogopa is also briefing the public every week. And within Cabinet, he also gives us updates. I must say, from discussions at that level with him, we are rather more optimistic than the pessimism of going to level 7 or 8. In fact, from you know, just indicating the maintenance which ESCOM is doing, there is a lot more optimism that in the next few weeks and months things are going to get better. It is quite hard. It is quite hard. We're still striving for more health facilities to be exempted from load shedding. It's one of the things which in our meeting here we will be discussing. I'm also with the CFO who's leading that interaction with ESCOM. So we will get an update as to how this province specifically is affected. But from our side, supporting provinces, we are making sure that more and more facilities can be exempted from load shedding.
Dr. Phahla, thank you very much indeed for your time. Tumelo, before we go, I just want to get a couple of words from MEC Meth. MEC, thank you so much indeed for your time. I mean, we are at a health facility that a few months ago itself was vandalized, people stealing cables. How common is this issue around the province?
Good morning to you and your viewers. Firstly, let's appreciate and welcome our Honourable Minister. Fortunately, we've told no lies and claimed no easy victories at the Eastern Cape. We've been laying bare our challenges, and we are happy that the Minister is here not just for challenges but as part of support that he provides to all the provinces of the country. Coming to the issue of the cable theft, I think the one that happened in this facility was the extreme. It does happen because we are part of the society. From time to time we get those interruptions, but not to the magnitude that we experience here. But we are happy that the people of Tanzania and surrounding took it to themselves and said, not in our name, and they were able to help us to catch those thugs, and we were even swift in terms of turning around, ensuring that we retain the situation to its normality. So it's not an issue that happens all the time. What is just an issue is what we just mentioned of load shedding. But of course, as I said, we can't be spared because we live within society. But we are dealing with those issues, in particular because we've got our backup generators in majority of our hospitals, even though we can't have generators in all the more than 800 facilities. But it's the work that we continue to do, working with our national department and ESCOM. Okay.
Mr. Before I let you go, I mean, we've always been documenting some of the problems faced within the healthcare sector in the province, but there are a few good stories to tell. I mean, the paperless management system that is in place is, according to some, unprecedented in the province. I'm telling you, I was even not believing when I visited one of the rural clinics in OR Tambo, where they told me about ETIC, that they are paperless. It's one of our idea clinics of NHI that was delivered to our people. I think it was in 2019. And when you get there, you are even told when our clients come, they spend less than 40 minutes overall in a facility. So the issue of us being on the NHI and the issue of e-health is one that will improve the service that we give to our people. All right. Thank you very much indeed, MEC Meth and Dr. Phahla. Well, Dr. Phahla will also be briefing the media at around 2 o'clock. It's back to you in studio.